Actixim 1.5 grams. Detailed instructions for use. Actixim 1.5 grams. 1. Name of the drug. Actixim 1.5 grams. 2. Composition. Actixim 1.5 grams contains cefuroxime sodium equivalent to 1.5 grams cefuroxime. 3. Pharmaceutical form. Actixim 1.5 grams is formulated as a powder for injection and infusion. 4. Indications. Actixim 1.5 grams is indicated for the treatment of bacterial infections susceptible to cefuroxime, including lower respiratory tract infections, pneumonia, acute and chronic bronchitis, urinary tract infections, pyelonephritis, cystitis, urethritis, pelvic inflammatory disease. 4. Indications. Skin and soft tissue infections, dermatitis, abscesses, bone and joint infections, osteomyelitis, septic arthritis, bacteremia, infection of the bloodstream, post-surgical infections. 5. Dosage and administration. Dosage. The dosage of Actixim 1.5 grams is adjusted based on the severity of the infection, the patient's condition, and renal function. Administration. Slow intravenous infusion. Infuse over 35 minutes or via duct. The tubing of an intravenous infusion set if the patient is receiving intravenous fluids. 5. Dosage and administration. Short intravenous infusion, maximum 30 minutes. 1.5 grams can be dissolved in 50 ml of one of the compatible solvents. Sterile water for injection. 5. Dextrose injection, 0.9 sodium chloride injection. 5. Dosage and administration. Slow intravenous infusion. Infuse over 35 minutes or via duct. The tubing of an intravenous infusion set if the patient is receiving intravenous fluids. 5. Dosage and administration. Short intravenous infusion, maximum 30 minutes. 1.5 grams can be dissolved in 50 ml of one of the compatible solvents. Sterile water for injection. 5. Dextrose injection, 0.9 sodium chloride injection. 5. Dosage and administration. Slow intravenous infusion. Infuse over 35 minutes or via duct. The tubing of an intravenous infusion set if the patient is receiving intravenous fluids. 5. Dosage and administration. Short intravenous infusion, maximum 30 minutes. 1.5 grams can be dissolved in 50 ml of one of the compatible solvents. Sterile water for injection. 5. Dextrose injection, 0.9 sodium chloride injection. 6. Contraindications. Patients with a history of hypersensitivity to penicillins and cephalosporins or to any component of the drug. 7. Precautions. Long-term use. Prolonged use of Actixim 1.5 grams may result in the overgrowth of non-susceptible organisms. Therefore, it is necessary to monitor for superinfection, and if serious superinfection occurs, the drug should be discontinued immediately. 7. Precautions. Use with other antibiotics. Exercise caution when using cephalosporin antibiotics in high doses in patients who are taking other drugs that may affect renal function, e.g., aminoglycosides. Renal impairment. Dosage adjustment is required for patients with renal impairment. 8. Adverse reactions. Common injection site reactions: redness, swelling, pain. Uncommon: nausea, vomiting, diarrhea, abdominal pain, dizziness, headache, fatigue, rash, itching. Rare severe allergic reactions: anaphylactic shock, hepatitis, jaundice, leukopenia, thrombocytopenia. 9. Drug interactions. Aminoglycosides. Do not mix Actixim 1.5 grams in a syringe with aminoglycoside antibiotics. Sodium bicarbonate. Do not use sodium bicarbonate injection to dilute cefuroxime sodium. 10 Notes. Storage. Store Actixim 1.5 grams at a temperature below 25 C, protected from direct light. Shelf life. Use the drug according to the expiration date indicated on the packaging. 10 Notes. Instructions for use. The drug should be used according to the instructions of a doctor or pharmacist. If you have any questions or concerns about the drug, consult your doctor or pharmacist. 11 Other information. Actixim 1.5 grams is a prescription drug and should be used as directed by a doctor. Do not self-medicate. Do not use the drug in excess of the prescribed dose or duration. Actixim 1.5 grams may cause some side effects. If you experience any side effects, contact your doctor or pharmacist for advice. 11 Other information. Note: this information is for informational purposes only and is not a substitute for professional medical advice. Always consult with your doctor or pharmacist before using any medication.